Good evening, everyone, and welcome to tonight's webinar, Innovative Laser Techniques for Enhanced Patient Outcomes with renowned dermatologist Dr. Tess Mauricio as our speaker tonight. My name is Peggy Chung, and I'm the marketing director here at VYDENCE. And tonight we're excited to dive into how our advanced technologies like the ProDeep, Dual Mode, and Hand Pico lasers can help you achieve outstanding results for your patients. So our webinar this evening will focus on the unique benefits of these lasers and how they deliver exceptional results across various skin types while ensuring safety and precision. We'll also have a Q&A session at the end where you'll have a chance to ask questions directly to Dr. Tess by writing your questions in the chat box on the bottom of this screen. Now it's my pleasure to introduce our speaker, Dr. Tess Mauricio. All right, I think we need to go to the next slide. Yep, so that's tonight's agenda, and we can go to the next slide after that. All right, so Dr. Tess is an award-winning, board-certified dermatologist, a graduate of Stanford University School of Medicine, and a summa cum laude graduate of UC San Diego. She is the founder of M Beauty Clinic with locations in San Diego, Beverly Hills, and Chula Vista. Dr. Tess also served as the president of the San Diego Society for Dermatologic Surgery, becoming one of the youngest women to hold this position. You may recognize her from her appearances on Dr. Phil, The Dr. Oz Show, America's Next Top Model, and The Talk. She also stars in and produces All in the Family with Dr. Tess on GMA Pinoy TV and takes care of celebrities like the Kardashians, Paula Abdul, Julian Lennon, Black Eyed Peas, and Boys to Men. We are very honored to have her here with us tonight to share her extensive knowledge and experience. And now to kick off our webinar, I will turn it over to Dr. Tess.
Hello, everyone. I'm so happy to share my some of my experience with VYDENCE laser, and thank you so much for joining us tonight. I'm here in my San Diego office. Thank you to the VYDENCE team for your trust, and I'm going to start with this kind of crazy, you never know where life will take you photo. This is this weekend in Hollywood at the Hollywood Bowl with my husband and my daughter. And it's sort of a full circle. I just did a podcast this afternoon talking about my journey as an immigrant and how I became, dermatologist, and now Surreal taking care of the likes of Boys to Men and Paula Abdul, and they happen to be both headlining this weekend at the Hollywood Bowl, and we got to go, and it was amazing, and it ended with fireworks, and I was just so grateful. And so I start off this talk saying that I come here with like a grateful heart, and I'm going to share what I find to work for me. There's a lot of trials and error, and by no means am I saying this is the only way to do things, but this is what we do. And so this is Paula after the show. She's 62. She just completed 48 shows during the summer with New Kids on the Block. Amazing. And she continues to inspire. And she's been my patient for many, many years. And, people are amazed at how good she looks, especially at the end of her tour right here. And then, so that was Sunday when I went to the Hollywood Bowl, got to see Boys to Men. And this is Wanye Morris. Wanye, if you know, some of the Boys to Men songs, he's the voice, when on Bended Knees, he's the one that does the amazing runs in the end. And so on Monday, he visited me. This is at my Rodeo Drive office. He visited me for his post-tour refresher. And in my practice, what really is amazing, and one of the key things that I look for in technologies is really the ability to treat all skin types. And you can see, there's Paula, who is also Middle Eastern, and then also here Wanye, and we did a full treatment on him and his wife, and he's very, very happy. And again, it's just so amazing that we're able to help him.
I am done
this at the end
with my treatment with Dr. Tess. I feel amazing. I feel rejuvenated. My skin feels just right where it needs to be. This is the only place to come. I'm trying to tell you. Come get the treatment. The whole treatment. It's amazing. Let's go.
Yeah, thank you, Wanye. So that's immediately after the treatments that we performed for him. And so I'll start with that. And my journey has been a long one already. It's been 20 years. now, since I started my first office here in San Diego. My family immigrated here in 1984. I went to, the only time I left was for medical school at Stanford, and we established family-based dermatology, cosmetic dermatology office here. And I can kind of tell you maybe in the Q&A, the journey of seeing this whole entire industry explode and all the different technologies that have come into play, and what I've learned and why I love our VYDENCE devices. So I am the founder and CEO of M Beauty Clinics. We have 3 offices, and in Southern California, again, we have a very, very diverse patient population. I am Filipino, and so I definitely look for technologies that are good for skin of color. I was actually one of the first physicians to actually even lecture on skin of color and complications in treating skin of color. And so I helped launch a lot of the radio frequency devices, the color blind energy, to be able to treat all skin types. And so this is a true passion for me personally, and this definitely extends to our patient care as well. So in our practice, we have 3 nurses. 2 of them are my siblings. This is a family affair at M Beauty Clinic. We also have estheticians. When I started the practice, I was doing all of the treatment, and my brother, who has an RN and an MBA, said, "Why don't you delegate?" And so the ability to delegate, really, it took me a long time because I'm very particular, and to pick technologies that I feel are safe enough, and also can be learned, and simple enough to use so that I can delegate with confidence is very important. I have many, many different technologies that I own. Obviously, I have a multi-platform IPL. I have a fractional. We have a fractional radio frequency microneedling. We have plasma laser device. And so I will tell you why I ended up choosing VYDENCE. Regenerative aesthetics, before that term, regenerative medicine is even coined, we were in that field already. We helped pioneer a lot of combination protocols with platelet-rich plasma combined with energy-based devices. And we will talk to you today about our time machine procedure. And so 10 years ago, we introduced that in our practice, and then I started lecturing about that. And then now, obviously, PRP and microneedling is everywhere. Combination protocols, I truly believe that this is where the VYDENCE platform can really help you take your results to the next level, take your ROI to the next level, because it is beautifully integrated with many of the technologies that you probably own. And then marketing and branding, I've been very fortunate to have had the platform to educate the general public, TV, social media. I've done a lot of TV network guesting and educational segments. Actually, I'll show you later that there's one that I've done recently for VYDENCE Pro Deep, for the treatment of hair loss. And then there's one coming up for the treatment of hidradenitis suppurativa. And so that is really important as well. Marketing is important, and partnering with a company that has KOLs and goals to actually, show the world what it can do as far as the results can really help your practice. So I've already alluded to many of these. What I look for in technology, I really don't buy technologies just because someone has it or just because there's a huge marketing hype. There are many technologies that you've heard of that I never bought into because it didn't fit my criteria. So these are my criteria for what I look for in technologies if I'm going to purchases. Again, my practice is a small, boutique practice. It's not a multi-physician group. It's not an academic institution. So I really have to think about the ROI, and I have to think about how the new technologies play a role in combination with the existing technologies that I've already purchased. So, of course, I'm excited about new technology, the novel science, novel applications, game-changing technology. I am known in the industry that if I purchased it, it probably really, really works. And not so much even like the name brand, but the actual application of it to deliver the best results for my patients. And so I really, really search. And because of my visibility, and I've been in the industry now for a long time, and I have made friends in the industry. People always present to me new technologies, and I do evaluate because I'm always searching for the best one to incorporate within our existing offerings. And so I get to look at them, and then, like I said, many of them I say no to. It has to be a unique offering to patients. If you already have a device that is doing something like laser hair removal or tattoo removal, if the box that you're going to buy only does that, it doesn't make sense to bring that, and then now you incur new monthly payments. So that's the key, is not to bring on technologies that are going to cannibalize existing technologies and existing treatments, but will actually be synergistic to use in combination protocols or add to your offerings. One of the things that was my pet peeve for the longest time is consumables. And I know that VYDENCE, really, because it's from Brazil, I think culturally in Brazil, they really hate consumables. Who likes them? But if you do have a choice of bringing on technologies where you're not thinking about, okay, going to this pulse is going to cost me, or activating and turning on this machine will cost me. You're just really geared towards creating great results for your patients, customizing their results without consumables. That is a winner. Versatility, as you've seen with my patient population, we have a culturally, ethnically diverse group of patients. We have a lot of patients, skin types 4 to 6, who come to us specifically looking for our expertise for treatment of skin of color. And so the technology really should be able to be used on all skin types. We still have some technologies that we only save for maybe Fitzpatrick skin types 1 and 2, but those are ones that I bought way, way, way back until kind of I've learned my lessons. Portability, because we have 3 offices, this is very important. Not only the fact that we can move it around, it's not a giant, heavy device or a platform or a box. We're able to move it around so that we have the flexibility. If like maybe a patient decides, they want to treat their hair, if I'm treating their skin, or if that they can just wield that device if I'm doing a different treatment. And then I wanted to add on maybe skin resurfacing, they can wheel the device to me and without having any major issues. The ease of use is really key. And I joke about this because I'm going to be 53 in November. And so I just want it to be simple. I want it to be easy for me to kind of be able to use it so that it's fun to use. It's not stressful to use. Also, for my team, when I'm going to delegate it, I want this to be easy to learn, and so that I can feel confident that they are going to be able to deliver the types of treatments that will deliver great results, but also be very, very safe. And then the bottom line is results. And I don't really care about the brand. I don't really care that, it's out there, it's on the billboard. But if it doesn't work, that will create a problem for you. And if you are building a practice, if you are building a brand, if you are building integrity and trust, and this is really the key to why we at 20 years, despite the ups and downs of the economy, despite COVID, despite so much more competition every day, more and more. I mean, there's a new med spa every day in Southern California. We continue to thrive because we are delivering great results, and we don't go by hype. We really evaluate, and we really create incredible game-changing results for our patients, so they love us. So combination therapy, I love combination therapy. And like I mentioned earlier, about 10 years ago, we launched Time Machine Procedure, which is really one of our signature treatments at M Beauty Clinic, where we combine different cutting edge technologies to deliver the best results from the patients. And why do combination therapies? This is an incredible slide, and hopefully you'll be convinced. Standalone treatments, say if you're going to do treatments for sunspots, age spots, you can charge a certain amount of, maybe $300 to $500. Now, if you added other things like microneedling or PRP or, laser skin resurfacing or a collagen building type of treatment, you can do a full combination. And what I've learned over the last 20 years is that patients don't care about the machine that you use. They care about the results. Okay, so it's like if you were at a tasting menu for a chef. You don't really care how they put it together, but you just want the best tasting menu, right? And so we put it all together for the patients. You can customize it, and the patients will get the best bang for their buck. And then for you, instead of selling the individual treatment, you now are selling the value of the result. You get full correction. You look much better when your patients go out there in public. There will be much better ambassadors for you, and your business and your practice will be more successful. So this is our Time Machine Procedure, and this is combination of a CO2 at the time resurfacing and platelet-rich plasma, microneedling, a couple of syringes of a filler, and a little bit of Botox. And you can see incredible improvement after 10 days and even after 1 month. Amazing. And so how much will patients pay for this type of improvement versus if you just did a little bit of Botox or if you just did color correction? So think about combination protocols. Here's another patient. And again, we treat all skin types. So the types of technology that we apply to the patient can change depending on their skin type. And that's how we can customize. This is an incredible improvement after a single treatment. This patient is actually the mom of the Kardashians' esthetician, and she flew in from Norway just to have our Time Machine Procedure. I treated her, and this is her result a month later. So this is also the reason why we have a lot of people from all over the world flying into Southern California so that we can treat them, because in a single visit, we can do so much. So the VYDENCE Pro Deep is also incredible for acne because it can really heat the sebaceous glands. It also can help remodel some scars. And this is a boy who's in high school and severe cystic acne. His mom is like in tears because he plays a lot of soccer, and it's very painful when he sweats. And it's in that crucial teenage time where, it can really affect his self-esteem and confidence. And this is after a single treatment with what we combine photodynamic therapy with Levulin, and we use the VYDENCE Pro Deep laser, and incredible after just, a few months. It is a huge difference, not just in the active acne, but also in his scarring. So this is Leonardo Nam, also at our Beverly Hills office, and he was getting ready. He is an actor who now is Maddox Hatter in the Disney's Descendants. And this was like the week before his great big premiere. And he came to the clinic. He had this coloration on his skin. And we used the hand Pico device from VYDENCE as well as the Pro Deep device on him. So I'll just play this. We posted this one on social media.
Hey, so the summer's coming and I have some old sunspots from previous years. I've got a premiere coming up, so I am going to go see Dr. Tess.
Leo's Koreans, again, all skin types here.
And you have a big premiere too. There's a new amazing laser for Asian skin.
Oh, yes.
Yeah, so it's a hand pico by VYDENCE.
Okay.
That's what we'll do, and will help with discoloration. And then it also creates a little bit of improvement in the quality and texture of the skin.
Okay.
And then there is also a VYDENCE Pro Deep treatment that gives you this heating underneath the skin, and so you get improvement in if you're acne prone or anything like that, because we've talked about that. That will help with that.
Yeah.
And then also give you a nice resurfacing without too much time.
This is the hand pico device.
We're going to use the Pro Deep laser, and this is going to do two things for Leo. One is it's going to address some acne prone skin. As an actor, having to wear camera makeup, that definitely clogs his pores, and so that's going to be treated with this. And then it'll also give him some nice resurfacing without too much downtime, because he's very busy, right? Leo, we're going to get him ready for his premiere.
So we did both the hand pico and the Pro Deep.
We finished the Pro Deep resurfacing for Leo. There's a little bit, very mild erythema on the skin. You feel good? Leo doesn't hurt? Didn't hurt? You're good? Okay, so now we're going to do a little bit of a very, very light resurfacing on his neck using the dual mode hand piece. So get started.
You can see that with one patient, we used the hand pico, we use the Pro Deep, and then we also use the dual mode resurfacing. And that's really the versatility of the Etherea platform. And it's so easy to switch them. There's no downtime for calibration. And so that's what makes it fun for me, because we can really customize the result. We can address the patient's needs right there on the spot. And this is Leo at the premiere of Disney's Descendants Rise of Red. And so maybe any of you guys will watch him. And he looked amazing. So we can customize how much downtime the patients can have depending on what they tell us. And this is Leo's husband, Mike. And so he came to Leo's appointment, and he obviously is fair-skinned, Caucasian. And so we were able to go a little bit deeper in the resurfacing. We used the dual mode handpiece on him. And we also added a little bit of Botox for his forehead. And you can see this is incredible improvement in a single treatment. And one of the things that I wanted to also point out is a lot of times my patients will send me their own photos. So, I wanted to just share some of his photos that he sent me. These are actually from his phone because these are not retouched. These are his photos. And you can see the improvement in the quality, the texture, the fine lines, the wrinkles, the sagging, the plumpness of the skin is better. So it's just an overall improvement. And this is him smiling, and you can see even that, excess crepey skin in the under eyes, and the depth of those wrinkles are so much better. So he is so happy. So he's actually inviting us to hang out with him and stay at their guest house. That's how happy he is. So that's him. All right. So this is the dual mode. This is, let me just back up. So the hand pico is the world's first and only fractional picosecond laser handpiece with two wavelengths in it. It has the 1064 and 532, and it's used for pigment and tattoos. And in my practice, because we treat a lot of skin of color, we have a lot of patients with melasma. It's really like the bane of my existence sometimes, but there's so many patients with this that we really want to try to find the safest and most effective treatment. So I can't wait to treat more of our patients with the hand pico device, those with skin of color with melasma. And so this is the dual mode. The dual mode laser is an erbium YAG, but it works like a CO2. And let me show you this. It's very fast. I was really impressed. You can do single mode, you can do dual mode, you can just go and zap individual lesions. It's very, very tolerable. We actually have treated patients where I've done CO2 resurfacing on them, and they are pleasantly surprised at how tolerable the actual treatment is. The results, as you've seen from the last before and after from Mike, is incredible, but we didn't have to put him under. We didn't have to do any nerve blocks, just topical numbing plus the nitrous gas was totally fine, and we were able to really get great results with that. So yeah, it's very easy to use, and like I said, it's very tunable and customizable. And you can treat the under eyes, you can do multiple passes, so you can really get artistic with the device. And that's kind of what I like to do. And you can use it not just on the face. You can treat the neck, the chest, and you'll see later we even treat the hands. So definitely whenever you see a patient and they want improvement with their face, we always quote them for face and neck. And then in some patients, we actually quote face, neck, and chest, because I really look at that as a unit. And in the past, it wasn't any really good technologies to address the aging of the neck, but we really have this now. So no one has to walk around with aged-looking, sun-damaged necks anymore. And that is a smoke evacuator, because like I tell my patients, you really are smoking. There's great ablation that's happening there. And then this is the time machine procedure where we use the VYDENCE dual mode, and now we follow it with platelet-rich plasma. Platelet-rich plasma will decrease the inflammation, immediately cools the skin. It allows me to go more aggressive on the resurfacing, especially in patients with skin of color. We are microneedling it to increase absorption of the growth factors, and then also the microneedling adds a little extra, collagen induction therapy, and you can really go more aggressive with the microneedling in areas where you have deeper wrinkles. And then, after that, we also will inject the platelet-rich plasma, and then we'll finish off with exosomes. And so here, see the video. Later on, you'll see this gentleman, because he did the segment with me on Fox News. This is Phil Lauer, who is the anchor on Fox News, and I recently did a segment on hair loss and the use of VYDENCE Pro Deep Laser. We're so impressed. He decided he'll stop in, and this was yesterday. I treated him with the dual mode. And we treated his main area, problem area, this is under eyes. And so you can treat the upper eyelids, the lower eyelids. Obviously, you want to be safe, good protection, and we only do it right at the orbital rim. We don't go lower than that unless you're going to use intracorneal shields. You can see the pattern there, and immediate redness. And then we applied exosomes on the skin, and then this is a peptide mask, and you can see how the redness that he has on his skin there immediately post. So this is a good treatment, but he was really able to tolerate it. So I really feel that is a big, big win for using VYDENCE, because we can go aggressive, but the patients are tolerating it. And he actually told me he is willing to do it again, because sometimes when you perform very, very painful procedures, no matter the results, the patients are so traumatized, they don't want to do it again. So here you go. So you can use the dual mode basically everywhere, not just the face or neck. So we use it for the hands, and don't forget your hands. This was posted in social media and my Instagram. I combine it with fat transfer and nano-fat stem cell resurfacing. And it's great because you can resurface even the fingers. There's definitely aging that happens there. One of these days, I want this treatment. So this is the before, and then that's after just 2 weeks. And as we know, collagen formation continues to improve over time. She's come in since, and she is one happy patient. This is her before and after. And
the good news is that they're
This is
incredible
that
treatments,
Fox
and that is what I'm so passionate about.
Well, let's talk about those treatment options.
Yeah, so
Go
this
ahead.
one
Bill,
is the
who did this,
latest
who got the
laser
dual
technology. This is VYDENCE Pro Deep. It's a painless treatment, and this is 1340 ND YAP laser. It targets the hair follicles. It increases blood flow. It gets rid of toxins. It activates those hair follicles that are sort of getting tired or not active, dormant, exactly. And so the key is to get treatments early on. Don't wait until the hair follicles are gone and dead. And
okay, all right. So the patient that I treated, and if you remember this patient, she was our original time machine procedure patient, but obviously that was like 10 years ago. She hasn't come in for any major treatment. So this was her just like about a month ago, and we did the dual mode time machine on her, and this is her at a month later. Improvement in sun damage, deeper wrinkles, and we also treated her neck, and you can see the lines are so much better, a lot softer. The coloration of the skin just looks so much more healthy. And see, the depths of the wrinkles are improved, the sagging, because you get nice tightening as well. And she is very, very happy with the improvement. Look at the neck. It's really, really amazing for the neck. And you can also improvement around the eyes. So just check the time, and it's 4:43. 5-day healing, and I had her take a photo. Even though it's tolerable, it's definitely doing it. Is a 5 to 7 days downtime. Stay away from the sun, and they are, applying healing creams after, but it is very effective. So I'll go through this quickly because I know your reps can go through this part, but I just wanted to start off with my experience of my patients. So the platform that we have is the Etherea, and it's, like I said, versatile, has over 70 FDA clearances. It is from Brazil, so it is the home of skin types 1 to 6 treatments all year round, and so for skin of color as well. Easy, it's powerful. We're getting great results. That's the bottom line. Zye platform is if you want hair removal and tattoo removal. We don't have the Zye, we have Etherea. Pro Deep, I've already kind of mentioned this. It is a 1340 ND YAP laser. It is a new wavelength exclusive technology from VYDENCE, and how it works is it creates volumetric heating pattern for non-ablative fractional skin resurfacing. With skin of color, you want to just go more conservative because it can create some, redness, and you do still have a potential for post-inflammatory hyperpigmentation if you go too aggressive. So start off slower and more conservative. It is a subdermal treatments that basically is up to 9 times deeper than the gold standard non-ablative fractional laser, like the Erbium Glass 1540 nanometers laser. And we can use it, like I said, just for the Pro Deep alone, for the hair growth, it's worth it. Hidradenitis suppurativa, we will be running a study in our office for that. We know that we can help a lot of people for acne to incorporate in your current acne protocols. It's really amazing. And it's the 1340 nanometer ND YAP Pro Deep. It has a low affinity for water and melanin, and so it really offers great higher bulk heating, and that's really the key in trying to reach the hair follicles for hair restoration, trying to reach your oil glands and killing the bacteria, and also remodeling acne scars. Again, fractional non-ablative subdermal skin resurfacing. And you can see that it is, the action is deep. That's why the name. And so the Pro Deep, histologically, it shows the creation. So you are getting a non-ablative thermal coagulation column with the use of this. And then, you can get a little bit of maybe redness, but within about 3 days, the full epidermis is restored. And so at that time, they can go back to their regular skincare or, makeup if you are going aggressive. But you can titrate the settings so that you get zero downtime at it, totally. So here you go. If you're going low energy, you get just a smaller coagulation zone, and then you can absolutely go higher and get more effect, more heating, a larger thermal zone improvement. And this is a paper showing that it can help in the treatment of nodulous cystic acne resistant to isotretinoin. And in our practice, we always talk about it, VYDENCE, in conjunction with everything else that we offer, especially for those patients who are being referred to start using isotretinoin, and especially those younger patients whose parents don't want their teenagers to be at risk for potential side effects. And the bottom photo is for the improvement after a series of treatments with the Pro Deep for hidradenitis suppurativa of the buttocks. So this, you can see it's incredible. You can imagine how painful it used to be, but now it's a lot better. And so many KOLs are seeing similar results, and it's only going to be more people. In Brazil, VYDENCE has about 70% of the market because it works. The dual mode you saw is a 2940 erbium YAG that acts like a CO2 because of dual mode function. Essentially, erbium YAG has 10 times more absorption by water than the CO2 laser. The issue before is that it may not have, you're not getting as much coagulation and it's more resurfacing. But with the dual mode, you are getting both resurfacing and you're getting also deep heating. So you will get that collagen formation. So this is just showing that you can get resurfacing, and then you can get a deep heating, coagulation, and then you get reepithelialization and get your results. So ablative versus non-ablative laser. Obviously, not ablative laser, you'll have a little bit more hand holding, more post care, more potential for PIH if you are treating skin of color. But that is where PRP and exosomes can help decrease inflammation, decrease your risk for PIH, and also again, decreasing the fluence, increasing your wavelength as well, can help. Duration can help. So these are all the different types of ways in resurfacing that you can do. You can do collimated, fractional, and you can do fine lines, light resurfacing, no downtime or minimal downtime, 1 to 2 days, like what you saw with my patient, where it was a 5 to 7 days of downtime, but she needed it. She had deeper wrinkles, a lot of sun damage. You can treat superficial lesions. There are different tips that go with the dual mode. You can treat scars as well. We don't have the true lift yet, but I heard that's coming. And these are some case studies from VYDENCE, that before and after a single session with the dual mode. And improvement, definitely improvement. And again, you can titrate the settings depending on what they are able to do. Improvement and brightening of the skin, improvement in the wrinkles, the quality, the texture of the skin, and some tightening. So the hand pico I mentioned has both the 1064 and 532. You can treat benign pigmented lesions, but I think in our practice, if you already have an IPL, where this is going to be amazing, are for patients with skin of color. And those patients with skin of color, sunspots, age spots, lentigines, and also melasma. And you can see incredible before and afters. With hand pico, you do have to counsel your patients that they will need more than a single treatment. It's not fast, but it is safe. And so you will need a series of treatments. But if you do a series, like in these before and afters, it is a great improvement. And so you can see even melasma can improve, and lentigine. So I'm really, really excited to use this more for my patients. Tattoo removal. We actually didn't have a tattoo removal device, so we are so excited to use the hand pico for tattoo removal. And that's my part. And thank you all for listening. I'm going to hand it over to my friend Carter.
Dr. Tess, thank you. My goodness. First of all, take a breath. Yeah. Incredible. You are amazing. First of all, Dr. Tess and I go back 15 years, and what she's become is incredible. I mean, she shows all these celebrities, but she's a celebrity in her own right, for sure. So we treasure our partnership with her. The thing we love about Dr. Tess is she's always coming with ideas. Hey, we got this media idea, we got this celebrity. You just can't ask for more than that with a physician partner. So thank you, Dr. Tess. First of all, you're hired, by the way. You did an amazing job on all of our technology. So I'll be quick here. But first of all, I'm Carter Morgan. I'm Vice President of Sales for VYDENCE here in the U.S. And on behalf of our founder and CEO, Andre Tanaka, and everyone in Brazil, everyone here in the U.S., we want to thank you so much for spending some of your evening with us here. VYDENCE is a 20-year-old company, over 20 years, and a lot of people are saying, why are you just coming now? We tried to come about 5 years ago, right before COVID come to the U.S., and then COVID shut things down. So now we're completely direct here in the U.S. with direct salespeople who I would put every one of them up against any other competitor in terms of laser knowledge and true consultative selling. So please reach out to us, and we'll make sure you get fully educated. And then direct service and clinical. We've got a warehouse with spare parts and finished goods in Tampa. So all of it's coming from the U.S. here, not in Brazil. So I want to make sure that you don't think there's any delay or anything like that. So as we say, we didn't invent anything. We didn't invent IPL. We didn't invent CO2. But we try to take whatever was best in class in aesthetics and make it better. And what does that mean? Like Dr. Tess said, no consumables, plug and play. No calibration time, single session. So it's much, much faster, and it's all about the patient, because Dr. Tess might be treating somebody for tattoo, but then she can take her hand pico out, put a Pro Deep in and say, let me just get this quick acne scar. And it takes, 30 seconds, and there's no cost to her with no consumables. So it's much more about the patient. So we feel very good about that. So anyway, one thing she did not talk about was IPL. We do have an IPL. It's a square pulse, and it comes with 6 cutoff filters. And then we also have 2 vascular tips, which focuses the light for curved small areas like telangiectasias and such. Pro Deep did an amazing job. The nice thing about the Pro Deep is it's been called the scar eraser, and it's so fast, and you can just use it in so many ways. I need to get out to Dr. Tess for a full week and have her go head to toe on me here. The hand pico, any of our area sales managers, they say, hey, congrats on the new job. What's different? Some of your doctors might say, what's different about VYDENCE? The 2 things that are truly different are Pro Deep at the 1340, which is a different crystal, the ND Yap, and then the hand pico. To take a large pico system and shrink it down to a hand piece is just a technological marvel. And so we're obviously pulling a lot of the cost to you out, and then to be able to have that in a handpiece with both pico and nano capability. Next slide. The alternative to the hand pico for us is the Achroma. We've got a Q switch, which is also 1064-532. It does not have pico technology, but it does have nanotechnology for great tattoo removal and melasma and such. Dual mode, you heard a lot about. It's not CO2, it's CO2-like. And what does that mean? It's just less downtime, more flexibility. Dr. Tess, like you said, year-round, skin of color, and much, much less downtime. And then our long pulse is our vascular handpiece. Our vascular offering is built into our Zye platforms, our Alex and Yag. But if you wanted a Etherea, like Dr. Tess has, and you wanted vascular, then you'd have the 1064 nanometer for our vascular lesions and many other things, spider veins. Next slide. Two that we don't talk about quite as much, but we're certainly proud to offer as well as a infrared intense IR, then also the Go Smooth, which is a 1540, which is a much more standard wavelength. 1340 is unique to us. The 1540 is very standard. A lot of people like that, so we offer that as well. And the next slide. And then these, when you get the Zye, we suggest you have a fiber as well. Need you to get a fiber. And the one that we is most popular for us is the 324, the blue there you see. And that's the biggest spot for hair removal. Typically, as our area sales managers will walk you through, if you want to do the types of things that Dr. Tess is doing, an Etherea is totally fine. If you want to move to hair removal, you need more power. The Zye runs on 220, the Etherea is on 110, and you want a bigger spot for backs and such, and that's the 324. So again, thank you so much, Dr. Tess, and we'll move to questions now with Peggy.
All right. Thank you so much, Dr. Tess and Carter. That was a super insightful presentation. I know we're coming up on time, but I think it was really valuable for the attendees to hear about the details and also your experiences and your different treatment techniques. So now we have a little bit of time, and I want to open up the floor for questions. You can feel free to write your questions in the chat below, and we'll do our best to get to as many of them as we can. So, all right, our first question tonight, Dr. Tess, you have a big population with skin of color. What specific considerations do you take into account when treating, patients with skin of color with lasers like ProDeep, Dual Mode, and Hand Pico?
Yeah, I think I answered that question, but I think the main thing is that, you want to be on the conservative side. Sometimes if you're really, not yet familiar with the device, then you may want to just do test spots. Because you do worry about PIH. But the great thing about the VYDENCE device, especially the ProDeep, is that you can really use it. Once you get familiar with it and you've tried it, you get this confidence that you are able to use it for those patients. So you just want to make sure that you're not going too aggressive with your treatments. And if you feel like you need to go aggressive, say if it's deep acne scarring, you want to maybe add on anti-inflammatory regenerative therapies like PRP or exosomes, and then post-care. Some doctors may talk about pre-treatment of the skin with hydroquinone. I don't really do that. I'm not a big fan of hydroquinone. And so we don't do that type of preconditioning, but we definitely take care of them as far as regenerative therapies and treatments.
Fantastic. Yeah, that makes a lot of sense. And, along those lines, how do you determine kind of the appropriate laser settings and which lasers do you use? How do you know kind of which ones do you reach for?
It depends on what the problem is. And with the VYDENCE suite of devices, and then the existing technology that we also have, we really just can customize it. So if patients are there for acne and acne scars, then we can do a combination like I showed with that one patient, where it could be a treatment with photodynamic therapy along with the VYDENCE ProDeep. And then maybe we'll do some microneedling at the same time with PRP and then apply topical exosomes. So that's kind of how we put together the best combination protocols for patients. But the technology is available now, and it's really just a matter of, picking and choosing, and then getting to know and getting familiar and comfortable with combinations.
Yeah, that makes a lot of sense. And then, one last question, for some of those on the call who are kind of newer with energy-based devices, what kind of advice would you give to practitioners who are new to treating patients with lasers? Like what should they consider?
Well, the list that I started with, I think, you want a device or a platform that will allow you to at least treat the most common conditions, right? Which are, at least for a dermatology office, is discoloration, sun damage, wrinkles, sagging, acne, and unwanted hair. And then now, hair restoration. And so that's why when Carter came to me and said, we have this device, I was really intrigued by the hand pico. I never purchased a pico device because it's like $200,000. So anytime I have a patient where I've kind of maxed out on what we can do with our existing device, I would just refer them out to someone who has a pico laser, because it didn't make sense to me to have just pay $200,000 for a specific type of patient. But now with a hand pico as a hand piece, with the dual mode and the Pro Deep, it's like, I want to treat everybody with the hand pico now. And so that's the one thing. And then the other thing, like I said, is hair restoration with the Pro Deep, and then the acne treatment and the hidradenitis suppurativa. Those are the ones that really brought me to really investigate, take a look, try it, and we were really blown away with the results. We love using it. It's easy. It's delegatable, and the patients are very happy, and my team are very happy to use it.
Thank you so much for all of that information, Dr. Tess. That was super valuable. I want to also put up that last your thank you slide, so we can also tell everybody where to find you.
That's my fam.
Yeah, fantastic.
That's my family. So, and I'm always on Instagram, and you can scan that. I don't know, where does the QR? Okay, the QR code goes to our website as well, and Beauty Clinic Instagram. So that's it. And thank you again for your trust, and thank you for allowing me to share my experience. I'm always happy to help and give you my, my basically just my 2 cents. May not be always right, but
thank you so much again, Dr. Tess, for sharing your time, your expertise, and your experiences with us, and for answering all those questions. We're so grateful for your time and for your knowledge. And so for those of you who want to know more about how VYDENCE lasers can benefit your practice, we encourage you to also visit us at lasers.vidence.com. And don't forget to stay connected by following us on Instagram, Facebook, and LinkedIn at VYDENCE USA for updates, news, and more educational content. And with that, I'll say thank you to everyone for joining us this evening, and we look forward to seeing you at future events. Have a great night.
Bye. Thank you.
Bye.